All right, Dr. Ohsie, it's all yours.
Hi, good morning, everybody. Thanks so much for joining Grand Rounds, and thank you to Dr. Doherty for your excellent talk. This morning, I'm going to talk about iTunes, the sound of music during eye surgery. I have no financial disclosures. All right. When I first started looking into this topic, I was actually really surprised by the amount of literature that's been published over the years regarding music in the operating room. It has been studied across a variety of surgical subspecialties, and I was actually able to find a lot of information regarding the benefits of playing music for patients undergoing eye surgery. And during many of our commonly performed ophthalmic surgeries, especially cataract surgery, our patients are sedated but not under general anesthesia. So we have a unique responsibility to our patients while operating on them awake, not only to do their surgery safely, but to do our best to alleviate their anxiety during surgery, which may ultimately help make the surgery safer and also may increase patient satisfaction with the operative experience. Early therapeutic applications of rhythm and melodies can be traced back to ancient civilizations. The Chinese character for medicine actually includes the character for music. In ancient Greece, music was used to ease stress, promote sleep, and soothe pain. And in Native American and African cultures, singing and chanting were used as part of their healing rituals. The earliest known reference to music therapy as a treatment method appeared in literature as early as 1789. And over the years, music therapy has been formalized, recognized, and certified as a distinct profession. Dr. Evan O'Neill Kane was a surgeon, probably most well known in the history of medicine for removing his own appendix under local anesthetic. But he was also known for his many innovations and inventions in the field of surgery. In the early 1900s, he was credited as the first to play music with a gramophone prior to anesthetizing the patient, believing it had a calming effect on his patients. Music with soft, soothing melodies was preferred over jazz or other sentimental tunes. In recent years, according to a survey by Spotify, nearly 90% of surgeons and surgical residents listen to music in the OR, and this is up from 63% reported in a 2008 study. A good summary of the physiologic benefits of listening to music on postoperative patients was recently presented at the American College of Surgeons Clinical Congress 2024 in San Francisco. Results at California North State University College of Medicine analyzed existing studies on music and its role in helping people recover from surgery. They narrowed a list of 3,736 studies to 35 research papers. And all of the studies included data on patient outcomes such as pain, anxiety, as well as measures of heart rate and opioid use. In their analysis, the researchers found that the simple act of listening to music during or after surgery, whether through headphones or through a speaker, had noticeable effects on patients during the recovery period. Across all of the analyzed studies, patients' self-reported anxiety levels were reduced when they were able to listen to music. Patients who listened to music also had a statistically significant reduction in pain reported the day after surgery, and that was recorded between 7 to 19%, depending on the rating scale used. Listening to music may reduce pain intensity, opioid requirements, and potentially decrease sedative amounts used. Patients who listen to music also experience a reduced heart rate, around 4.5 fewer beats per minute, compared to patients who did not listen to music. And this is significant because keeping a patient's heart rate within a healthy range helps improve recovery by allowing effective circulation of oxygen and nutrients throughout the body, especially to areas that were operated on. And in addition to tachycardia, tachycardia can lead to abnormal heart rhythms, such as atrial fibrillation. Other studies have shown benefits in reduction in blood pressure and respiration rates as well. Other primary studies and systematic reviews have shown that medical teams can also benefit from listening to music in the operating room. Music can improve concentration and efficiency for experienced surgeons, and it can also help foster a calming OR environment, which can reduce stress and improve surgical performance for the entire team. Certain music elements can affect the surgical task performance in a positive or negative way. In general, the studies, including the two listed here, have shown that the positive effect of music on a surgeon's task performance overrides any perceived negative effect. Classical music, when played with a low to medium volume, can improve surgical task performance by increasing both accuracy and speed. Music enhances spatial temporal reasoning as well and can influence the performance of a complicated physical task. Classical music, such as music by Mozart, was shown to cause an improvement in surgeons' memory consolidation and motor learning skills, which is important in training. A similar effect was also seen in surgeon trainees when they listened to preferred music versus non-preferred music. Listening to preferred music improved quality and time of wound closures. The Mozart effect is a well-described phenomenon that is debated as a momentary positive effect of cognitive improvement on the surgical performance in forms of decreased anxiety and stress, increased speed and accuracy, as well as improved acquisition of technical skills of novice surgeons. In this study, novice surgeons underwent a proficiency-based laparoscopic training curriculum. Participants were required to perform these tasks under 3 conditions: no music, music at medium volume, which was about 45 to 50 decibels, and that's about the level of like low or soft conversation. And at high volume, 65 to 70 decibels, which is loud conversation or similar to like a dishwasher or washing machine. Soft rock by the Beatles and hard rock by AC/DC were played. Task performance was evaluated by analyzing speed and accuracy. So in terms of the results, with soft rock at medium volume, participants were faster in peg transfer and more accurate in suture with intercorporeal knot compared to without music. The positive effect was lost if the soft rock was played at high volume. With hard rock at medium volume, participants were faster performing precision cutting compared to without music. Both balloon preparation and precision cutting were performed more rapidly at both medium and high volume, and the accuracy was maintained. And so the conclusion here was that generally well-accepted music genre in the right volume could improve the performance of novice surgeons during laparoscopic surgeries. But it's important to remember this study was done in a simulated setting and not in a real OR setting. I'm going to go through a few studies now that highlight the physiologic benefits that playing music perioperatively has for the patient. Peak patient anxiety is typically just prior to the start of a surgical procedure and tends to decrease just after surgery. Dr. Jorge Camara was an ophthalmologist in Hawaii and was well known for his live piano performances for his patients. He actually had a piano placed in the operating room for several months and played music for his patients as they were wheeled into the room and the staff was getting them ready for the surgical procedure. He published a retrospective case series in 2008, and he included 203 of his own patients who underwent various ophthalmologic procedures at Hawaii Medical Center East. Patients were divided into 2 groups. Blood pressure, heart rate, and respiratory rate were measured in the preoperative holding area and were compared with the same parameters taken in the operating room, either after listening to live piano music for about 10 minutes or listening to no music, just normal OR sounds for about 10 minutes before the start of the case. No anxiolytic medications were administered prior to taking the measurements, and the study included only those patients having surgery for the first time. And in this particular study, no additional music was played during the surgery or postoperatively. Dr. Camara played a random selection of music chosen from the pieces here in the list on the left, and it appears he selected mostly classical music. The music was played at a tempo he considered relaxing or calming. That's at an andante or walking tempo. On the right is a list of the procedures that Dr. Camara performed on these patients. He performed a variety of procedures, about half of them were cataract surgery, but he also included oculoplastics procedures as well. So the 115 patients who were exposed to live piano music showed a statistically significant decrease in mean arterial blood pressure, heart rate, and respiratory rate in the operating room compared with their vital signs measured in the preoperative holding area. And in the control group, the 88 patients not exposed to live piano music actually showed a statistically significant increase in mean arterial blood pressure, heart rate, and respiratory rate. So this study not only demonstrated the patient's physiologic response to stress and anxiety just prior to the start of the surgical case, but it also showed the calming effect that playing music alone can have prior to pharmacologic intervention. This was a randomized control study out of Taiwan that was published in 2022. This time the music was played while the cataract surgery was being performed. 92 patients were divided equally into 2 groups. One group listened to the standardized piano piece on repeat versus a control group that had no music. The one piece selected was Andromeda by Gabriel Tosi, and this was selected for the slow, relaxing cadence of the music, which was less than 70 beats per minute. And the music was also calibrated to maximum volume of 60 decibels to avoid startling and disturbing the patient or the surgeon with large fluctuations in volume. The music was started at first incision. Measurements of blood pressure and heart rate were taken at 4 various stages: during administering local anesthesia, at first incision, during phacoemulsification, and during wound hydration. In the recovery area, patients were asked to self-report their anxiety level preoperatively, intraoperatively, and postoperatively using something called the visual analog scale. Finally, salivary alpha amylase levels were measured at the beginning and at the end of surgery. So secretion of salivary alpha amylase has been shown in other studies to be involved in central autonomic nervous regulation. Increased anxiety has been linked to an increase in salivary alpha amylase secretion. So there was a statistically significant drop in salivary alpha amylase postoperatively in the music group compared to prior to surgery. And in contrast, there was a non-significant increase in salivary alpha amylase in the control group. In addition, there was a significant lowering of systolic and diastolic blood pressure at different points in the music group. And there was also a lower level of anxiety reported intraoperatively in the music group compared to the control group. There did not appear to be a significant difference in heart rate between the two groups. I have included a picture of the visual analog scale here in the corner, which is essentially the pain scale you've all seen before, except in these studies, it was used to measure anxiety level. The effects of music therapy can vary depending on one's personal experience as well as cultural and religious beliefs. Personal preference and familiarity of the music should be taken into consideration in order to provide comfort and relaxation and to avoid eliciting an unpleasant memory or emotion. When individuals listen to their favorite types of music, it increases the secretion of beta endorphin, induces pleasant emotions, and results in reduced pain. High-pitched music can actually elicit stress, while low-pitched, slow-paced, orchestral, harmonious music and music beats that were similar to a human heartbeat left people feeling relaxed and had good therapeutic effects when listening for at least 30 minutes. The maximum volumes of 60 decibels help to relax and relieve stress as well. These are some examples where preferred and regional preferences for music were explored. So a study done for cataract surgery patients in Greece used meditation music. Specifically, they used Peter Sterling's The Angel's Gift, and they had similar effects to the study from Taiwan. There's also a study out of Korea in 2017 where they played Korean traditional music, which was mostly instrumental. And this also seemed to achieve a similar effect to other studies using classical music. And so this suggests that some familiarity with the music induces a level of comfort. Playing patient-preferred or patient-selected music had increased physiologic benefits as well over surgeon-selected music, not only due to the familiarity, but potentially also because there's an aspect of control that can decrease stress levels for patients. And in a study of patients randomized to listen to various different types of music, including nature sounds, piano, harp, orchestral, jazz, or synthetic sounds, the most preferred by patients overall was the piano music. What about the effect of music versus other types of relaxing sounds, such as relaxing suggestions or affirmations and white noise? In this study, 121 patients undergoing routine cataract surgery were randomly assigned to listen to relaxing music or relaxing suggestions or white noise, and the control group had no added sounds. Vital signs were documented before and after retrobulbar block and Q15 minutes afterwards. Anxiety levels and patient satisfaction are also assessed. The conclusion was that the patients had a more favorable rating of the operative experience, and general level of relaxation was highest with the relaxing music, followed by relaxing suggestions, followed by white noise, and unsurprisingly, the lowest ratings were in the control group. A very interesting thing I came across while looking into this topic was the use of binaural beat music to induce relaxation. Binaural beats are auditory processing artifacts, and they're special sounds perceived when two auditory stimuli of different frequency are presented to each ear. When two tones that are close in pitch but not identical are sent to a different ear, the brain creates an interference, which is called a binaural beat. The difference between the two frequencies needs to be small, so below 30 hertz for the effect to occur. So for example, if a 400 hertz sine wave is played into the right ear and a 410 hertz wave is played into the left ear, the brain is entrained toward a frequency beat of 10 hertz, which is in the alpha range, and that's associated with relaxation. Binaural beats influence the brain through activation of the reticular activating system and can be used to reduce anxiety and increase the pain threshold. This effect was discovered in 1839 by Heinrich Wilhelm Dove, and the use of these beats as a therapeutic tool has recently gained interest among neurophysiologists and clinicians. So binaural beat audio has also been studied in patients undergoing cataract surgery. This prospective randomized controlled trial included 141 patients undergoing cataract surgery under under local anesthesia. The patients were randomized into 3 groups. There was a binaural beat music group, which was music with binaural beats embedded. There was a plain music intervention group and a control group, which had earphones with no music. Blood pressure and heart rate were measured on admission and at the beginning of and 20 minutes after the start of the operation. Perioperative anxiety levels were also assessed. Headphones were put on 10 minutes before the start of the operation. So in the binaural beat music group, binaural beats with a frequency of 20 hertz were played initially in the first 5 minutes of surgery. This is in the beta frequency range, if you remember the previous slide, and that was set to be tuned with the patient's likely brainwave pattern at this stage of preoperative anxiety and alertness. The binaural beat frequency was then set to decline gradually to the therapeutic frequency of 10 hertz, and training the brain to produce a beat corresponding to a relaxed state of consciousness in an alpha pattern. Musical arrangements with relaxing components of melodies, tones, and rhythms were also embedded with the binaural beats. A plain music audio without binaural beats was produced for use in the music intervention group. The presence of binaural beats was actually difficult to detect by experimental listeners. And if you're curious and want to hear this type of music, you can look up binaural beats on iTunes or whatever preferred music service you use and find a variety of music with embedded beats of different frequencies intended to induce specific brainwave states, such as focus and attention, relaxation, and deep sleep. Patients in the music intervention group and binaural beat group showed significant reduction of state trait anxiety inventory scores compared to the control group. But the difference was not significant between the music intervention and the binaural beat group. Systolic blood pressure was significantly lower in both groups compared to the control group, but again, there was no significant difference between the 2 groups. There was, however, a significant reduction in heart rate, but that was the only metric seen exclusively in the binaural beat group. So music both with and without the binaural beat can have similar physiologic benefits for patients, with the binaural beat audio showing additional benefit in decreasing heart rate. So I think it'd be interesting to see some further exploration of this topic in the future. One of the last topics I want to touch on is the effect music can have on pain control and postoperative recovery. There was a meta-analysis that reviewed over 4,000 titles and abstracts across a variety of surgical procedures that looked at music initiated before, during, or after surgery compared to standard of care without music. The choice of music could be made by either the patient or the researcher. The analysis showed that in the majority of cases, music reduced postoperative pain, anxiety, and analgesia use, and increased patient satisfaction compared to the control group. When patients were allowed to choose the music from personal choice or from a playlist, there was actually a slightly increased but non-significant reduction in pain and analgesia use compared with when patients had no choice. However, interesting, there was a slight but non-significant increase in anxiety when patients had to choose their own music. Pain, analgesia use, and anxiety seemed to be reduced most when patient was played preoperatively, followed by intraoperatively, and then postoperatively. Interestingly, music had an effect on reducing postoperative pain, analgesia use, and anxiety, even when the patient was under general anesthesia. But as would make sense, the effect was more significant when patients were conscious. The beneficial effects of music on patient well-being are consistent with expectations and the public's perception of music. So in general, it's thought that the music can reduce an individual's perception of pain by inducing the release of dopamine, oxytocin, endogenous opioids such as endorphins and enkephalins, and reducing muscle tension by interfering with nerve conduction, thereby reducing the transmission of a pain signal as well as feelings of anxiety. For patients who are conscious during the procedures, music can also provide a distraction from the surgery or the pain. For patients undergoing general anesthesia, some evidence from randomized controlled trials suggests that parts of the brain involved in hearing can sometimes still be perceptive during general anesthesia. So excessive noise in the OR while a patient is under general anesthesia was actually identified as an independent risk factor for postoperative pain intensity. The time proportion of noise greater than 70 decibels, which again is about the level of a running dishwasher or washing machine, is thought to impact neurophysiological activity of the brain and postoperative hyperalgesia. In this presentation, I mostly focus on data from cataract surgeries, but this is because there were the most studies available in this setting. Cataract surgery is actually a pretty ideal setting to explore this since it's widely performed, generally in high volume in most places. Also, there's very little variability in the procedure itself, length of surgery, and the patient population. Smaller studies have also been conducted to study the effect of music with other ophthalmic diagnostic procedures and treatments, such as with intravitreal injections, PRP for diabetic retinopathy, visual field testing, and serial IOP checks. So there are a few studies that actually found similar physiologic responses, improved patient experience, and decreased anxiety when music was played during intravitreal injections. Exposure to music before and during intravitreal injections therefore was seen to decrease anxiety, and most patients opted to have music played during future injections. So the use of music was concluded to be a safe and cost-effective intervention that reduces anxiety during intravitreal injections in the outpatient setting. Visual field testing is a highly subjective study that's reliant on patient cooperation and attention. Loss of concentration, inability to follow directions, patient anxiety and fatigue can also adversely influence the reliability of the test results. Multiple studies have been undertaken to assess the importance in performance of visual field testing after exposure to Mozart's sonata for two pianos in D major. And this particular composition was chosen because it was used in the original study that led to the theory of the so-called Mozart effect. In 2006, there was a study that randomized young normal subjects that were naive to visual field testing into a music group and a no music group. The music group was exposed to the first 10 minutes of Mozart's sonata immediately before taking the visual field test. And it was observed that the music group had significantly fewer fixation losses, false positive and false negative errors. And when the same study was repeated a few years later with elderly subjects, also naive to visual field testing, they found similar results as well. It was therefore concluded from these studies that listening to Mozart sonata improved reliability indices and also increased attention span among the subjects. However, this theory has been tested again subsequently with other studies in different groups of patients, and they didn't quite produce the same results. So I think the results are kind of equivocal. For PRP and serial IOP checks, no significant effect was seen with music, but these were pretty small studies with small sample sizes. While certain noises are unavoidable in the operating room, playing music is optional. The World Health Organization recommends that noise level in the operating room should not exceed 30 decibels, which is at the level of a whisper. Thus, as we continue efforts to improve surgical care, the decision to play music must be weighed against its potential as a further source of disturbance. Excessive noise can actually contribute to communication errors. It can lead to impaired understanding of orders and requests, and consequently, the staff may need to raise their voices to be heard, which could further amplify the noise level even more. And this could lead to significant increase in stress and frustration and decrease in teamwork and efficiency amongst the OR staff. Miscommunications can also be a potential source of medical error. Trainees with less surgical experience may also particularly be vulnerable to excessive noise and distractions in the OR, which can affect their concentration, productivity, and safety. And as mentioned in the previous slide, excessive noise in the OR can lead to increased pain perception, stress, and anxiety in patients as well. So in conclusion, I think there's plenty of evidence out there that playing music in the operating room has a potential to provide a significant benefit for both patients and the surgical team. In the past, I did not typically listen to music while operating unless the surgical staff chose to put it on. And I think some patients actually thought I was playing music just from listening to the sound of the phaco machine. Actually, I did have one patient tell me he did fine with the surgery, but he thought that I had the worst taste in music because he was listening to the sounds from the Centurion. Anyhow, these last few weeks, as I was doing research for this presentation, I decided to play a variety of music in the OR, mostly classical piano music, including that Mozart piano sonata for two pianos, and also meditative spa music. I think the fan favorite amongst the OR staff was actually the spa music, and it really made the OR feel more relaxed, and there was much less side chatter and distraction as well. My next step would be to more closely examine the benefits from the patient perspective as well. Overall, I thought this was an interesting topic. I hope you found some of this information useful, and I appreciate everyone's time and attention. And then my references, and thank you. I think there were some questions in the chat here.
That was great, Linda. You know, the comments that I've heard at the VA, we used to, residents would play music all the time. I think all the way until Canvas class, and then kind of tapered out, and now we don't have it. And I guess this reminds us that we should definitely start playing some music. But I think some comments that I've heard from residents is that they don't like it. It kind of either distracts them or they don't. So I guess.
And I think that's what the studies have found is that, that study with the laparoscopic the training session, that was in a very simulated setting. They're not in the operating room, they're not with patients. I can't imagine blasting AC/DC while I'm operating. I can imagine to be pretty distracting. And actually, when I played the piano sonata, I actually found that to be a little bit distracting because it's a very high tempo. It's about like 140 beats per minute, which is double like walking speed. So I felt it was a little bit much. So
I think it would be individual, but I think overall it definitely the patients might benefit, just as you said, they're not under general, but just sedated and they wake up in and out. And so thank you. This was great.
Thank you.
Yeah, that fascinating topic, that there's an incredible science around this. I think music for me over the years was more for me rather than the patient in terms of my relaxation. And as a result, I was the one who was pretty much driving what was being played. But that's just another angle in terms of the impact on the surgeon as well as the patient.
Did you ever play the cello in the OR, Dr. Lass?
In the office, but not in the OR. No, I played the last day of surgery that I did. I gave a recital after the surgery for the patients in the waiting room and my patients, and also at Landerbrook. So, but no, a fascinating story. I would love to get your permission to use this, have this recorded lecture. The World Doctors Orchestra is now going to be posting lectures on music and therapy, and this would be a great lecture to post on our website. I think it was a fascinating topic. Thank you.
Thank you. Absolutely. All right, I think we're past time, so I hope everyone has a nice day.